So if you're a physical therapist and you're struggling to help your patients get out of an anterior pelvic tilt, or if you're a patient yourself that is dealing with an anterior pelvic tilt but not getting the results that you're looking for, then this video is for you. What I want to share are my 3 steps to helping to really understand the true source of an anterior pelvic tilt, and then exercises to specifically get out of that pattern and start to restore movement. Step number 1, understanding the problem. So when it comes to fixing an anterior pelvic tilt, we first need to know, what are we going against? What do we need to do? And what I find is that it tends to be more confusing because of the anatomical jargon and biomechanics. These 2 things can be tricky and confusing for a lot of people. So what I want to do is go through a more simplified approach to the biomechanics in a way that's more practical. And I think when you understand it from a more practical standpoint, it's then a lot easier to manage and know what to do next. So let's go over the normal biomechanics and then more of the simplified approach. We have the sacrum here, which is usually in more of a nutated position. So that nutation tips forward, right? Nutation is coupled with extension, internal rotation, and adduction of the innominate bones. Now, how does that happen? Well, relative motion. Because the sacrum tips forward, relative to that, the innominate bones are moving back. So that's the extension piece. Also with that, when we go in this forward motion, we create a ton of space back here. And that is going to allow us to go into more of an internal rotation and adducted position, all right? So that's kind of the standard biomechanics, and that's what a lot of people know, and that's where it usually stops. That's where it starts to get confusing, because what do you do with the information I just told you? How do you fix that? Instead, I think it's a lot easier to understand where there's space and where there isn't space. What do I mean? When we nutate, because this tips forward, the backside, the posterior aspect of the pelvis has to expand, right? The sacrum has to be able to push back into that. So we are going to have space in the back and not have space in the front. I like to understand that by thinking of a locked door and an unlocked door. The backside is an unlocked door, meaning we have access to move in and out of it. The front side is a locked door, meaning we are jammed. We cannot go that way. We have to find an alternate route, and essentially we look for the locked door. So when someone's in their anterior pelvic tilt, they're going to move to that unlocked door, create space in the back, and then be jammed or compressed in the front, all right? Understanding and thinking like that is going to help us recognize what needs to be done when we choose exercises. So that's the pelvis. If we look at the ribs, the big takeaway here, again, we could do a whole nother video on this, is usually with an anterior pelvic tilt, we're going to have a rib cage that is flared into extension, right? And the low back is also in extension. And so you get this typical anterior pelvic tilt where the pelvis is going forward, the ribs are going up and back, and we're in a big overall extension pattern. So understanding those concepts brings us to step number 2. Get them good at what they're bad at. So we just discussed that an anterior pelvic tilt is an unlocked door in the back, which makes them good at finding space. Conversely, they're a locked door in the front, which makes them bad at finding space. So this step is called get them good at what they're bad at. So we just need to get them in the opposite pattern. So we need to compress or lock the door posteriorly, and we need to expand or unlock the door anteriorly. Now you may be asking, how do we do that? Well, we do that by prescribing specific and intentional exercises to retrain a pattern, aka get them out of their anterior pelvic tilt. So now we know we need to compress or lock the door on the backside and expand or unlock the door on the front side. And a lot of you may be asking, well, which exercises are best to do that? But I think the better question is, which muscles should I target to do that? And there's 2 that are going to be your good friend. 1, hamstrings, and 2, the glutes. Because of their attachments of those 2 muscles, they're going to compress the backside, and they're going to start to posteriorly orient the pelvis and start to counter-nutate the sacrum, but posteriorly orient, meaning move out of that anterior pelvic tilt. So with that said, I want to show you 3 hamstring biased exercises and the progression that you can go through to start to challenge the anterior pelvic tilt. So that way you can start to figure out where you need to start with your patients, but then where you want to start to bring them to. So the first exercise is a simple 90-90 isometric hamstring. Now, you could go through your normal kind of dead bugs and posterior pelvic tilts on the table. And what I would suggest is that your patient understands how to do a posterior pelvic tilt before going through this. But doing this exercise over those is a little bit more bang for your buck because you get more muscle recruitment. And the end goal is we are trying to train these muscles to hold a new pattern. So the more we can start to stress those muscles, the better response we'll get. And this is a pretty simple setup. I like to use a ball, and we're looking for a 90-90 angle. So 90-90 represents 90 degrees at the knee and 90 degrees at the hip. From here, all you're doing is cueing them to go into a slight posterior pelvic tilt. If you're not familiar with that, use a belt buckle as an analogy. So belt buckle towards the chin, not towards the feet. Towards the feet's the anterior pelvic tilt, towards the chin is what we're looking for. From here, all we're going to do is dig our heels down first to feel the hamstrings engage. As they do that, did they lose their pelvis, right? That's the key thing. We're trying to train a pattern. We need to train them how to keep the hamstrings on while maintaining that posterior pelvic tilt. And from here, all we're gonna do is cue them to reach both knees up towards the ceiling slightly, like a 1 out of 10, right? And just hold on to that. Next, we can bring our arms up, we can reach slightly, and then we can start to do 4 breaths. So what we're doing here, training the hamstrings to be engaged as a posterior pelvic tilt's happening, but also how to get the rib cage to come down, because remember, the ribs are also involved in this pattern. So we're trying to get the ribs down, and we can do that by reaching and then starting to breathe 4 breaths while maintaining the proper position. Next, we can challenge the position by not being at that 90-90 degrees. So the pelvis is going to bias more of an anterior pelvic tilt. They have to now work harder to hold that. So we'll do it with a foam roller. So all we'll do is put the ball between the knees, start with your heels on the foam roller, go down into a hook lying position, and from here, all we're cueing is to find that posterior pelvic tilt, like a 1 or 2 out of 10. Hold on to that. Can they then lift up? So can they extend their hip without totally losing their tilt? If they can, great. Then all we're gonna do is start to pull those hamstrings back, gas pedal both feet, because a lot of times they'll do this, totally different feel. Gas pedal, and then how high can they go while they are maintaining that posterior pelvic tilt and keeping those hamstrings engaged? So again, we're driving into an extension pattern, which they want to be in, right? But as we're going through that, they are not losing the position. That's the key thing. We're starting to retrain a position. That's how we get someone out of an anterior pelvic tilt. So our last exercise is back on the box, back to a 90-90 position, but now it's not isometric, it's dynamic. So all we're doing is a hamstring bridge where we are now moving through motion, but still having to keep the good position. Notice how position has been constant, right? Position is crucial because we're trying to change a pattern. So what we're doing here, we're going back to the first position. So 90-90 degrees, ball between the knees, engage the hamstrings, slight tuck, and then now we are going to ask them to extend the hip as high as they can go without dumping into their back, right? So they go through a much greater range of hip extension, and they're going to come down and tuck. As they go back up, they're holding that tuck. And the big thing is, as they start to descend down, we are not losing the hamstring. Again, position is the emphasis here. The hamstrings will burn. That's a distraction. Can they keep the hamstring burn, but not lose the position at the pelvis?